This is an interview of Mountain Family Health Centers with Dr. Gail Mizner, MD, by Jan Jennings, Director of Development of Mountain Family Health Centers. Dr. Mizner, when did you join Mountain Family?
I joined Mountain Family in September of 2010. My husband and I had decided to move to the area because we're both native or almost native Coloradans, and we're living in Arizona and just really missed Colorado, wanted to be closer to my father, wanted our youngest son to be able to ski race as he was doing at the time. And we love the Roaring Fork Valley and have long roots here. And so when I came, I knew I didn't want to go into private practice, and I found Mountain Family and actually worked hard to convince them that they should hire an internal medicine doc because they've been traditionally family practice based and still are. But I did convince them, and that's been very gratifying.
Wonderful. Well, thank you. What attracts you most about Mountain Family? I know you've been here for about 12 years so far, but is there anything that attracts you most about Mountain Family?
You know, I love the mission of Mountain Family to provide high quality care to people who might not get it otherwise in any other setting. Um, and I love the fact that I can really practice at the top of my license at Mountain Family. I can take care of patients with very serious, significant diseases and make sure that they get good care. Whereas, given both lack of insurance coverage and lack of subspecialists in our area, they might not otherwise be able to get that at all. And so I really enjoy um, both the relationships with the patients, how grateful they usually are, and and the intellectual stimulation of really constantly learning and constantly trying to figure out what's best for my patients. And the other part I really enjoy is that Mountain Family has allowed me to develop a sort of consultative role where the other providers send me questions through the patient's charts, and I can help them with internal medicine related issues and just help them work to, as they're always striving to improve the quality of care for our patients.
Wonderful. That's neat that you are able to act as a mentor and a lead for our medical staff as well. Now, I know you've practiced rural medicine and also in um, northern Chile. Uh, I was wondering, do you find something unique about Mountain Family that's unique among other health centers or rural-based health providers?
Yeah. Um, I think the thing that stands out at this point is that we offer relatively comprehensive care and that we have both behavioral health and dental health incorporated into our medical care. Um, the the other rural settings I've been in, my career started at as a faculty member at the University of Colorado, but my husband is a mining engineer, so I ended up following him around the world to for his work. And fortunately, a physician can sometimes it's difficult, but usually find a way to work almost anywhere. So I was in what was essentially a private practice, but only one of two practices in rural Nevada, in Ely, Nevada. And so learned there the the essential nature of making good contacts with subspecialists and other physicians who could help me manage patients in this very rural setting, but didn't have the kind of support in terms of dental and behavioral health that Mountain Family provides. And then when we moved to Chile, I couldn't practice right away. I had to do what they call a revalidation of my medical degree, which involved, of course, learning Spanish and then taking 6 exams in Spanish. 6 medical exams in Spanish. So, so it took me a little while to do that. And then I was in the public health system, which is relatively good, but has some major flaws as well, in Chile. And so there was, patients were always having to wait a long time for appointments, and it was hard to get them for them to get in. And sometimes we could get medication for them, and sometimes we couldn't. And just to get an ultrasound, for example, in a timely fashion, sometimes a patient would have to be admitted. So often, so certainly Mountain Family has its challenges with patients having difficulty paying for exams, radiologic exams they need, for example. But we have quite a dedicated staff and a system for helping patients with those issues. And we have staff that know where's the cheapest place to get a radiologic exam, for example, or what's the best strategy if we know this patient's going to need a lot of hospital-based care to help them manage that. So that I really appreciate as well. And another thing I really appreciate is the CAP fund we have, which is an assistance program for patients where they can we can give them up to $500 a year to help them cover outside costs for medical things that they need.
Yes, indeed. I appreciate the points that you've shared, and our outreach and enrollment team are fantastic in helping guide patients through, what are the different options to pay for health insurance or Medicaid, CHIP. And also, again, we do treat many uninsured patients as well, as regardless of ability to pay. We welcome everybody, and so I think that's a wonderful asset of this organization. I think you've covered some of this, but I was going to say, what are some of the greatest joys and barriers to providing medical care in rural areas, or even an area like ours here in the Roaring Fork Valley and the Eagle River Valley and Garfield County?
I think the greatest joys are seeing patients get better, seeing people realize that they have a good source for treatment and they're going to be taken care of, and that they can improve their health. I've experienced that throughout my career with people with HIV, and that's occurred over and over again, including in Chile, where people come in and think that they're going to die, and then realize that no, that there's a source of treatment and they're going to be okay and they can live a nearly normal life. So that's true for HIV. It's true for many of the rheumatologic patients that I treat who come in with terrible pain or other issues due to their autoimmune disease, and have no idea that actually we can treat those diseases with very inexpensive meds, or when we need to get expensive medications, have ways of trying to obtain those for them. So the gratitude that and relief that I see on patients' faces is one of the most rewarding things, I think. There are a lot of barriers. Hospital care is extraordinarily expensive. And even though I know that once a patient has a big bill at a hospital, often they will receive a major discount. It's very scary for patients to even think about, who are uninsured, to even think about taking on that kind of debt. And so that can be really frustrating to try to help them negotiate getting the care that they need.
Yes, indeed. Tell me, what has been the greatest challenge for you at Mountain Family related to the COVID pandemic?
Most of my patients have been pretty great about getting vaccinated. So I've had probably less frustration than some of my colleagues in terms of day after day facing patients who are unwilling to get vaccinated, and therefore putting themselves, their families, their community, their healthcare providers at risk. Um, but I still feel that frustration to some extent. I think just keeping all of us going, and safe during this lengthy pandemic has been really the biggest challenge. And I know our staff it's hard not to feel burned out. I've felt it myself at times. And yet, reality is that the pandemic is still ongoing and we still need to be taking the precautions we're taking and encouraging patients to get vaccinated. And our staff has done an incredible job of vaccinating people and offering mass vaccination clinics. But it's taken its toll, and people are tired and sometimes don't have as much time to work on the other medical issues that are so important for our patients as well. So we're really all stretched pretty thin, and especially the people who are on the ground in the clinics every day.
Yes, indeed. I believe that our organization, Mountain Family, has provided over 15,000 vaccines since the pandemic has begun. In addition to all of our regular integrated care, like you were mentioning beforehand, medical, dental, and behavioral health care all in one home. So it does certainly take a toll on everybody, but I know, and I've been very pleased that we've been able to give back quite a bit. And my understanding is that among those vaccinations that have been provided, about 70% have been provided to the Hispanic and or Latina community. So
Yeah.
it's good to hear that it's being taken advantage of. Um,
Yes. Yeah.
can you please describe your role on the Colorado Prescription Drug Availability Board? What are the aims of this board? And what an honor to be included.
It was an honor. I was quite surprised when I was asked to do it. This is new legislation that creates this Type 1 board. Consists of 5 people who are charged with picking up to 12 prescription medications per year on which we place a cap on the cost. And so that cap will affect not just patients, but also pharmaceutical companies, insurance companies, et cetera. So there are a lot of stakeholders involved and of course, pharmaceutical companies that make the medications. So there are a lot of stakeholders involved in this. The board it's because it's brand new, we're creating the rules and everything else as we go along, of course, following the legislation as it's written, and with a wonderful staff of people who do much of the work for us. But we've now met twice, and we're still in the process of rulemaking and choosing an advisory. We've chosen an advisory council for us, and we've got a consultant group from Harvard that has helped Massachusetts go through this process as well. So it's quite an adventure for me and something that's relatively new to me, but I'm pretty passionate about it because I see on a daily basis the barriers that patients face, both insured and uninsured, to be able to obtain much needed, important, essential medications. So I'm pretty excited to be a part of this experiment of seeing what we can do to decrease medication costs in our state.
We applaud your service here, Dr. Mizner. And one other thing that's wonderful to know about with Mountain Family is that we've started to roll out our own pharmacy program where we are providing some pharmaceutical drugs at a very, very low cost to our patients. And my understanding is that we launched this first in Edwards and that it is up and running and that we're planning to roll it out at our different hub sites in Basalt and Glenwood Springs and Rifle. So
Yes, I'm incredibly excited about that 340B program, which I think is launched this week in Glenwood. It's really going to make a huge difference for many of our patients. Because it includes medications, many of which I've been prescribing for my patients with rheumatologic conditions, which are not necessarily completely unaffordable, but which, when taken together, produce a considerable cost per month. And so to have these medications now available for them for pennies, and to have, for example, insulin that can cost thousands of dollars available for almost nothing, is just going to make a huge difference for our patients. And I'm really excited. I can't wait to send the first prescription.
Yes, I think we are all excited about it, and again, just thrilled that we started in Edwards, and you said we're launching it in Glenwood Springs.
Yeah, yeah.
This wonderful. I wonder if you had some thoughts. It's an interesting valley and community that we live in, especially with Aspen being a resort community, and we're housing some of the wealthiest residents in the United States. But data shows with our seasonal workforce and more, those who are commuting all the way from, Parachute up to Aspen sometimes, that we have 1,400 residents in Aspen who are living below the federal poverty level, and they're not using our healthcare services so far. We've done some analyses. Do you have any recommendations as to how we might connect to this group of the underserved? I mean, even in our Aspen community and or other communities, do you have any recommendations for how we reach this group of people?
One of the things that I think we need to do is make the employers of these folks more aware of the existence of Mountain Family. I'm pretty startled. Much of the time when people ask me where I work, wealthy Aspen people or middle class Aspen people ask me where I work, and I tell them, and they've never heard of Mountain Family Health Centers. And so if those people don't know about it, people who have a language barrier and and aren't necessarily listening to the news may are going to also be unaware of it. So I think that would be one approach, is to just make people, the entire population, more generally aware of the existence of Mountain Family and what we do. The other thing, and I know we have communication with the community health center, but certainly encouraging them to refer patients who are appropriate down to us would make a lot of sense. And then I think the other thing has to just end up being word of mouth. So patients who live up in the higher part of our valley need to know that the basalt clinic is there and available to them, and be encouraged to make appointments.
Thank you. I think, again, too, I mean, just because it's unique that we provide integrated care of medical, dental, and behavioral health care all in one home, I think that's also something that we need to promote, and make many more people aware.
And people do not realize that the costs, especially if they're on sliding scale with us, even if they're not,
Yes.
are so much less than anywhere else in our valley. I mean, we have very expensive medical care here in general, but Mountain Family is really an oasis in the middle of that.
Oh, well, thank you. One thing I wanted to salute is not only do you give to Mountain Family with your work here as a medical doctor and a consultant to our other practitioners and providers, but you've also become a founding member of Mountain Family. And here we are just thrilled that founding members are a special group of benefactors to Mountain Family who've made a 3-year pledge to support our organization and help build our fiscal sustainability. Because, again, as you know, it takes funds to make sure that we can treat everybody, including the uninsured, when we have up to 40% of the uninsured. Can you tell me, and again, just honoring your gifts as a founding member, are there any words that you want to share as to why you've been so motivated to support Mountain Family and our Health for All fund?
I believe that everyone has the right to good health care. Mountain Family is probably the biggest organization in our valley, not that there aren't others, but the biggest organization in our valley that is really working to provide anyone who needs it with good health care. And so that is my passion. I also, learned to speak Spanish fluently in Chile, and so it's important to me to use that gift that I received to help a population that is drastically underserved and I know what it's like to live in a foreign country and to feel like even making a phone call is a difficult thing to do. And so I have a lot of compassion for people who are in that situation, and I want to help them.
Oh, thank you. Along that note, is there any message that you would want to send to our Spanish speaking community, given that you're fluent in Spanish and have been caring for so many in
Um,
Spanish? Would you want to
yeah,
share
yeah.
any first?
Tu salud es súper importante. No solamente prevenir la enfermedad de COVID, pero tratar y prevenir otras enfermedades antes que se empeoren mucho. Y en Mountain Family, en las clínicas de Mountain Family, podemos ofrecerles buen diagnóstico y tratamiento con poco costo, y espero que van a tomar, van a venir a vernos y ver lo que se puede hacer para mejorar su salud.
Wonderful. Well, thank you. Thank you so much for taking the time with us today, Dr. Misner.
I
And it's a great, great pleasure and honor to have you working with us. So thank you so much. Appreciate all that you're doing and take care.
Thank you, Jan. You too.
Goodbye.